and welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. American College of Physicians updated guidance for colorectal cancer screening of asymptomatic adults. The American College of Physicians, or ACP, issued updated guidance for colorectal cancer screening for asymptomatic average risk adults that suggests starting screening at age 50. The guidance is based on a critical review of existing clinical guidelines and evidence reviews and modeling studies used to develop those guidelines. The goal of this ACP guidance statement is to help guide physicians on when to start and stop screening and on the selection of type and frequency of screening tests in asymptomatic average risk adults. In this updated guidance, ACP suggests that clinicians start screening for colorectal cancer in asymptomatic average risk adults at age 50 years. Consider not screening asymptomatic average risk adults between the ages of 45 to 49. Clinicians should discuss the uncertainty around benefits and harms of screening in this population. They should stop screening for colorectal cancer in asymptomatic average risk adults older than 75 years or in asymptomatic average risk adults with a life expectancy of 10 years or less. Statin treatment initiation shows age as a substantial independent predictor of LDL-C response. A study of more than 80,000 persons found that age is a significant independent predictor of low-density lipoprotein cholesterol or LDL-C response to statin treatment initiation. The initiation of low to moderate intensity statins was associated with a greater reduction of LDL-C in older persons than younger persons, regardless of whether the statin was prescribed for primary prevention, for secondary prevention, or among patients with diabetes. Patient-to-patient LDL-C response varies widely in statin treatment. The reduction in LDL-C may depend on the age of the patient treated. Persons older than 75 years have been underrepresented in randomized clinical trials, which limits evidence about the effects of statin treatment in this age group. While current guidelines recommend statin use for secondary prevention in older adults, fermented tea drink may reduce blood sugar levels in people with type 2 diabetes. People with type 2 diabetes who drank the fermented tea drink kombucha for 4 weeks had lower fasting blood glucose levels compared to when they consumed a similar tasting placebo beverage, according to researchers at Georgetown University and School of Health, the University of Nebraska-Lincoln and MedStar Health. This finding from a pilot 12-person feasibility trial points to the potential for a dietary intervention that could help lower blood sugar levels in people with diabetes and also establishes the basis for a larger trial to confirm and expand upon these results. Kombucha is a tea fermented with bacteria and yeast and was consumed as early as 200 BC in China, but did not become popular in the US until the 1990s. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.